emotional disorders, which shatter us completely. In the modern world, mental health disorders have become a leading cause of disability globally, exacerbating human health. With the divine blessings of Lord Dhanvantriji, hope lies in Ayurveda. Dr. Navdeep Sharma, a spiritual healer from the city of the Golden Temple. His graduation from Sri Lakshmi Narayan Ayurvedic College, one of the oldest institute in our country, associate with Sri Durgyana Education Foundation. His masters from the University of Madras. His PhD in the role of Ayurvedic herbs in psychological disorders. Listed in the World Book of Records for promoting Ayurveda and developing a chain of Ayurvedic treatment and Panch Karma centers in various parts of the globe.
डॉक्टर नवदीप शर्मा को दुनिया भर में आयुर्वेद का जागरूकता फैलाने के लिए सम्मानित किया गया। लंदन में इंडो यूके लीडरशिप समिट में द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने दिया उत्कृष्ट पुरस्कार।
A very good evening to all of you who are joining us here live from UK, and a very warm welcome to all of you joining us from US, from Canada, from India, and from various parts of the globe. Once again, I, Dr. Navdeep Sharma, I am joining you up for my live in the series where I'm trying to take the maximum of your questions and I'm trying to discuss quality Ayurveda with you. It's always my utmost attempt that any of your questions which you ask from us, we are not missing out on those questions. Your questions are the most important ones for us, and as we try to discuss Ayurveda with you, we also try to take your questions simultaneously. So any one of you who is joining there with us, please remain there with us, be there with us, post your question, provide us with some proper details, and once I complete my current topic of discussion with you, your questions are something which I will immediately be coming to. Sangeeta ji, I acknowledge your question, and I will be coming to your question once I am through with my first topic for the day, which is depression, because that is something which I always see, which I always feel in any parent, specifically here in United States, United Kingdom, and then in United States, in Canada, in all other countries where the support system at home is a bit less and a lot of work has to be done by the parents themselves. The daily chores are also to be managed by the person himself or herself. They are managing a child who is also having a lot of hyperactivity, a lot of irritation, and specifically in all these developed nations, it becomes really tough if the rules are not being followed because of a child. Just other day, I had a parent from UK who gave us a call and who updated my team that their neighbors complained about the child to the police. So it is very much understandable that the parents, when they are facing all those problems, all those troubles, at times the parents will go in depression, anxiety, depression. Now these are some of the things which will really hamper the parents, but it is really very important for the parents to be healthy mentally, emotionally, physically, so that they can support their autistic children on their way out of autism when the entire treatment curriculum is being done with us. Because as I always say, it's the parents of a child who are the best psychologists for the child. So the parents are the best psychologists, the most important psychotherapist for the children, and that is why during our entire treatment curriculums, we always train the parents. We give ample training to the parents so that the parents, they can work on the children, and with the help of the parents, the children can come out of autism. So that is why if any of you as parents is feeling any kind of depression, any kind of problem because of children, do remember that while we will be working on your children, for you as parents, any kind of support that is required in depression with the help of Ayurveda is always there. Because rather than taking sleeping pills, rather than starting with a lot of selective serotonin reuptake inhibitors and those pills which are then going to be a part of your life for a long time, it's always advisable to take some harmless herbs like Jatamansi, Tagar, Vacha, Brahmi, Shankpushpi, those herbs in the proper specified dosage by a physician. And at the same time a bit of changes in the lifestyle, a bit of modifications in the diet, which can bring a person out of depression so that they do not have to become patients by themselves rather than giving treatment to their children who are suffering from autism. So talking about autism, when I say autism is a temporary phase in the life of a child if treated timely, I always mean my words, because when we talk about autism, it is not a disease of the brain, it is a disease of the mind. In most of the autistic kids who come to us, it is the mind which is really troubling. It is because of the mind that the child is not focusing, the child is hyperactive, is not responding, is not doing eye contact, and all that stuff. So, when we say we give treatment for autism, it is the mind on which we work for your child. So moving ahead, first of all, I would be going ahead with your questions, and once I am there with your questions, I will then be going ahead with some common discussions which is beneficial to each and every one of you as parents. So the first question which I can see is of Mr. Joshi. Mr. Joshi, you are a new member for our channel. Thanks a lot for promoting our channel, and you have mentioned that my baby Vishrut is 6.5 years and concerns are how to increase the sitting tolerance, and then repeating of sentences till response, how to increase social interaction and sharing self-thought. So Mr. Joshi, I would like to tell you over here that when it comes to, he's 6.5 years in age and we need to increase the sitting tolerance. So when we need to increase the sitting tolerance, what becomes very important over here for us is that we need to be working on the subconscious mind. Whenever we talk about the sitting tolerance basically is increased with the usage of the subconscious mind promoting herbs. So while I am taking the questions, I would like to request my team, you can forward the questions of your patients to me with the comments which you have for them, so that none of the concerns of your patient is missed out on art. So I will be taking the questions of all of you once I also share the details. So please be with me. I'm leaving and dropping a few messages for my team backend over there. Yeah. So I am going ahead and with the next question over here. As Mr. Joshi, I just mentioned, in your case, the sitting tolerance will be increased with the help of subconscious mind promoting herbs. Some of them are jetamansi, tagar, vacha, and for that we generally advise Breno R to our patients. Now Breno R is a supplement which comes in the form of a syrup, which comes in the form of granules, depending upon whether you are coming to us in a OPD or you are meeting me up in UK, US, anywhere. So it comes in the form of syrups, it comes in the form of granules, and this Brainoir is a supplement which directly works on the subconscious mind of your child, due to which a marked improvement in the concentration span is noticed when it comes to the social interaction. Now when all other things they improve with the help of the herbs which we are using, and also with the help of the ABA which we are doing, when all those things are improving, then at a particular stage we start working on the social skills of the child. Now those develop at the last. GRG, you have mentioned that every day a new issue arises in the behavior of your child and you are very worried about how long it will take to get better. GRG, I would really appreciate if you can share some further details on this, and I am waiting for the team also, if they can put me up certain details in regards of GRG's child, so that I can be going ahead and guiding further. And then we have with us Sangeeta ji. Sangeeta ji, you are from Bangalore and you have joined us, and you have mentioned सर हमारा ट्रीटमेंट 1.5 ईयर हो गया है, स्पीच इंप्रूव है, बट कर्शिव का एवरी 2 मंथ्स बिहेवियर चेंज हो रहा है, फिर से रिवर्स चला जाता है, इरिटेटिंग, क्राइंग फिर से बहुत ज़्यादा करता है। रितिका मैम एज अ साइकोलॉजिस्ट, टीनम इस कोऑर्डिनेटर, सर ये बार बार बिहेवियर चेंज क्यों होता है, मेडिसिन में क्या चेंज करना है? आई वुड लाइक टू नो, यहाँ पे मैं संगीता जी, आई वुड लाइक टू नो फ्रॉम योर एंड, when was the last time that we met? Now why I am asking this question, this is a question and this is a advice for anyone who is taking treatment for autism for the child from us. Now see, what is very important for us to realize is that every 6 months the treatment has to change, new targets have to be fixed, ABA sessions have to be changed. So there are lot of things which change when we talk about the treatment curriculum. At times what happens is when the parents they start visualizing improvement in the child, they miss out on meeting, interacting through a physical meet or through a virtual session. So I would really appreciate if you can mention over here when was the last time that we interacted with each other on one-on-one session, because in a child like Karshiv who is 3.7 years of age and where you have seen initial improvements also in the child, it becomes very important for us that we do not miss out on interactions, because things have to be planned. If we do not plan the things, if we keep on giving the same kind of things, yes, then definitely the problem is that the child may come back towards the normal behavior. There will be ups and downs, but if we are consistently meeting, if we are consistently planning out the treatment in phases of 6 months, then there will be no looking back in case of your child. And going ahead, thanks a lot for the appreciating words of Ignite Learning Ji. You're also our member and you also are very motivating for others. And going further ahead, uh, Sugumar Chandrasekhar ji. Sugumar Chandrasekhar ji, you are there with us, and as I can see over here, and in recent days, this sleeping pattern is very disturbed. Every night he awakes at midnight and awakes for a longer time. Dr. Aarti is your doctor, and Brenoir Hotsip DS. The evening Brenoir Hotsips, they need to increase. Go take them to 10 ml. The cephalogo which is giving in the morning needs to be stopped. Immediately stop that. And it has been mentioned that you have taken 6 ABA sessions with Arshdeep, Amardeep and Rashmeet. Now the ABA sessions are the biggest hindrance over here in your child's progress. In case of RN, what is very important that we started in December 2024 and moving ahead with at least one and more advisably 2 sessions per week in a year's time approximately. Even if we say in 7 or 8 months time, the number of sessions should have been far more than we are currently. See, whenever we are using herbs for your child in autism, those herbs are going to bring a positive deviation in the behavior of your child. The child will become more acceptable, the child will become more receptive, the concentration span will improve, the subconscious mind working will improve. Now, with all those improvements occurring in your child, what is very important for us to realize is that despite all those improvements in your child, the behavior yet has to be changed and modified through consistent ABA sessions where we train you as parents and you are doing that ABA stuff for your child. It should not be a case where you leave your child at a center or you are dependent upon someone who is trying to teach your child a tab-based ABA. It has to be one of us for your child, either you at your own home where you are getting trained and getting it done from your own end, or you guys coming to us where we are doing everything for you, but one of us has to do it. If it's neither you and neither we, then it is something which goes wrong. So going ahead with the next question, my brother, you mentioned over here that you want to meet in UK, and yeah, it is pretty late because already every slot has been finalized and there's a lot of effort which is put on by my team in collecting all those videos, in compiling everything up, and then in forwarding it our way. Then the huge team here in UK also works on those kids. So at the last juncture, accommodating anyone becomes a problem for us. However, since you have joined my live, and it's my duty now to ask my team to fix your slot somewhere. So yes, you can get back to the team on the number, and team, you can fix up a slot, you can modify someone's slot and fix him up somewhere as he's there on the live. And I also really want that whenever I am here, at least during my stay over here, no child should be left about, because my next visit is going to be in April now, and with a lot of gap and a lot of time between the successive visits, it really becomes a problem, because with every passing day, with every day where the age of the child is increasing, the chances and the speed of recovery, it goes on reducing. So it becomes very important that we do it quickly. And the next question is from uh, have you treated any patient with a progressive genetic disease? My teenage son has infantile hereditary spastic paraplegia. He is unable to walk independently, unable to talk, and the disease is progressing to his upper body. Can Ayurvedic medicines be helpful for him? And you are currently connected with Dr. Aarti, and she is the one who is interacting with you. See, what I would like to tell you over here is that whenever it comes to any genetic disorder, any genetic disorder needs a thorough evaluation. And yes, we can modify the expression of genes by using the right kind of herbs and therapies at the right age. A genetic disease cannot be modified at any age. It has to be modified up to a certain age and up to a certain level of the expression of genes. Once the genes fully express themselves, then it can only be managed. So, yes, there's a lot of work in Ayurveda that is done on genetic diseases, but having said that, genes can never be changed. Their expression can be modified. As a result of that, unlike other autistic kids where we say that the child will completely come out of autism, in a disease with genetic manifestations, a child will always improve depending upon the age. The improvement can be exceptional, the improvement can be good, but we need to have a thorough evaluation in this case. So going further ahead, uh, Rida Zafarji, and Rida ji, it's Nikhil who is your coordinator, and the age is 3.1 years in your child's case, and the child is non-verbal, he is lacking understanding, and sometimes he follows commands, other times he will not follow commands. Surita ji, see, when we talk about a child who is 3.1 years in age, now the age is the best part over here. It becomes very important for us to realize as a parent, the younger the child, specifically if the child is below 4.5 years of age, believe me, it is the golden time for your child to come out of autism. Many a times the parents, they keep on thinking, they keep on waiting for miracles to happen. They go to people claiming miraculous treatment curriculum. Someone is taking homeopathy, someone is taking Ayurveda, someone is going to a therapist. Unluckily, the time below 4.5 years is lost. And once we talk about below 4.5 years of age, so below 4.5 years of age is the golden time, just like your child being 3.1 years. If we go in the right way, if we immediately follow everything, and if there is no brain damage in the child, which I don't feel is there, because in at least 90% of the cases with the children, they come to us, they are without any kind of brain damage. So generally it takes 1 to 1.5 years for a child aged 3.1 years to completely come out of autism. Having said that, not a single day should be wasted, and the treatment has to be done with thorough evaluation. It should not be you taking a single online product and carrying on with the treatment and thinking that yes, the treatment is being done. Definitely, any kind of single combination which we are using online, which we are taking from our end, will always help your child. But we do not want just a child to improve. We want a child to completely come out of autism. And for that to happen, it really becomes very important that we need to work as a team. Once the parents work with us in tandem, when they believe us, yes, definitely, the child can win out of autism. So, moving further ahead, and the next question is from uh, God Sisabel, and you are our member, and you have mentioned that what's the best exercise to target poor proprioception and the vestibular system in kids that is hyperactive, can proprioceptive or vestibular cause an adverse reaction. And your name is Jason, and you're Jennifer, and you're talking in concern of Jason. You are from US, and you started with our treatment in December 2024. The biggest problem which I see over here is, once again, it's only 4 ABA sessions that have been completed, and the most important thing for us to realize over here is that yes, there are herbs which will work on the proprioceptors, which will work on the vestibular system. But the most important thing which we are to remember over here is that the best work which occurs is through the ABA sessions. So at any stage, we should not be missing out on the ABA sessions. If we miss out on the ABA sessions, now that is what really causes problems. At times, the herbs will work, but the parents, they fail to realize that in reality, the ABA, the applied behavior analysis, the one which we are guiding, not the one which is just done for formality's sake by many therapists. I won't be saying anything wrong about the therapist, but believe me, when I go through the videos which parents share my way, I am very disappointed looking at the sessions which are being done for those children. The children deserve far better sessions. It should not be a case where the child is just generally the therapists are just killing the time of children, and as the age passes by, it becomes more and more tougher for us. And along with that, since Jennifer, since Jason, we are also talking about the vestibular issues. The panchakarma which we do, the therapies which we do really work miraculously for children in that regard. So at any stage during treatment, if it becomes possible for you to travel to India, do give it a thought. A lot of things can be done over there. And I would also appreciate, Dr. Aarti, I asked you the other day also, if you can share the details of the treatment being given in that case, because I am not having the treatment, I am just having the 4 ABA sessions done with Devyanshi. No medicines, no details are there with me. If you share the details with me, be there with us, Jason, and in case I get some details in regards of the medicines, the combinations, the herbs which are being given to you, I'll be commenting on that also. Rinku Patel ji, a very warm welcome over here, and Rinku ji, you have mentioned that hi sir, my son, and for those of you who just joined as our members, I really appreciate, because whenever we talk about membership, it's just a support for Ayurveda that you are doing, and we really like that, because when we talk about Ayurveda, I always dream that Ayurveda should be promoted around the globe. Ayurveda is a science of life, and if we are following Ayurveda, it's not just for the sake of autistic children, but for the sake of humanity. The more Ayurveda can be utilized, the more we can get a healthier life. And that is why, for those who become our members regularly, your membership really promotes our channel, and that is always a word of thanks from my end for all those. So Rinku Patel ji, you have mentioned, hi sir, my son is 5 years and 5 months old and he's autistic. We know his autistic is 3 years and 5 months, and after then we are going to all therapies like occupational therapy, speech therapy, but it's not work. He speaks a lot, but when I want to tell him, then he didn't understand. He speaks alone when he wants something. He didn't tell me, just like Gaurav gave me your reference, and it has also been mentioned with me that uh, that you connected with Gaurav, and it has been a long time since you connected with Gaurav. So what is very important over here, Mr. Patel, is to understand that your child is now 5 years and approximately 5 months in age. Had it been done below 4.5 years of age, just like I mentioned to another gentleman or the lady who was there, that it takes around 1.5 years of time below that age. But after age of 4.5 years, still, Mr. Patel, we still can bring your child out of autism. But now for that to happen, it requires around 3.5 years of time. And the more and more time we let go away, a gradual stage comes when we can give improvement. We cannot bring the child out of autism. It is not at every age that we can bring a child out of autism. So if you believe in Ayurveda, if you believe on us, if you had been in consistent touch with us, do not waste time. Every single passing day is going to make the things tougher for your child. I understand. It is tough for someone to believe that it can be done. With so many occupational therapists that you went for, with so many behavior therapists and other therapists that you went to, did you ask any one of them that have they ever brought a child completely out of autism? Their answer will be no. They may have given some improvements, but they have never brought any child out of autism. And when I talk about myself, it is now long 24 years since I have been working with autistic kids. When I started working with autistic kids, autism was not so much prevalent around the globe. And today, when I look back, there are children who come to me who are now married, who are MCAs, who are MBAs. Some of them, I also had some press conferences where one of the autistic kids is sitting in front of me, and the best part is when the child says it for you. But what happened was that their parents took the first bold step. They believed, they worked under our guidance, and they did not let a single day go wasted. And with you being someone who have maybe having a background there in India, as I can see from your surname, it should be easier for you to believe in Ayurveda. We have people who don't know anything about Ayurveda. When I practice in UK, when I practice in Canada, when I get so many patients from UK, they all travel to India. They meet me at times out of India. They travel to India. They are connecting with me online through video conferencings. And despite having no knowledge of Ayurveda, no knowledge of yoga, no knowledge of Panchabhutas, they still believe in Ayurveda. And once they believe, and once we do things for them, yes, the children, they come out of autism. So Mr. Patel, it is possible for you also as a father, but please do remember, we have to wait. We have to do the right thing. We cannot achieve that just waiting and waiting. Occupational therapy is not going to bring your child out of autism. And going ahead, uh, I am having with us Nauja Rosemary. Nauja Rosemary ji, welcome to the live session. And you have mentioned that my son is 3 years, 6 months old. He was very okay until he was getting to 2 years old. He stopped saying the few words. He was saying tiptoes and holding the mastoid part of his ears and cry every time. Is it good to do an EEG test and some other test to know what is wrong with the child before going to the treatment? And Nikhil is your coordinator. The best part is that the age is 3.8 years. And while Nikhil was giving me the history of your child, he has mentioned a high screen time. So rather than going for any test, we should firstly always try to figure out a reason in autism. Just like you, there are many parents when they will see this problem in their child, what they feel is that it is due to a problem in the brain or a problem in the EEG. And not just you, there are so many who will prefer going to a center for those tests. Unluckily, in some of them, the EEG also shows spikes, and in many of them, the doctors then will start with anti-epileptic protocol. Please do not go for any such test as of now. The child is below 4.5 years of age, and this is the right age where if we go even for 6 months protocol and we work in a nice way, since the child was earlier using words, he should again start using words. At this age, yes, it is pretty possible in 6 months. But for that to happen, as I just requested the another gentleman, Mr. Patel, that now the child is above 4.5 years of age and it will take more than 3 years of time. Here the child is below 4.5 years of age, Ms. Rosemary, so it should be taking from 1 to 1.5 years only. So this is the right age. Get back to Nikhil, see what can be done. Not a single day should be wasted in this case because the child was verbal at some stage. It was a high screen time. The child has developed virtual autism. Let us bring him out of this virtual autism. There is no benefit in going for any test in the beginning. If required, once I interact with you on a one-on-one session in a physical or virtual way, if I feel, I will advise something to you. But going ahead and looking at the first juncture, I don't feel we require any test for the child. because all those sensory issues, the toe walking, all those are interconnected to a higher usage of the conscious and a lower usage of the subconscious mind, which generally happens when the screen time is more. So once we start working on his current situation, automatically we will see improvement in all these aspects like toe walking, sensory issues, aggression, hyperactivity and speech. So the best part is he is 3.8 years in age. I have a very good 7 to 8 months to work on him. So going ahead with Victor. Victor, you asked me that when are you coming to New York? Have an appointment to see you personally. So you are there in New York? Yes, I'll be definitely visiting over there. The most probable time is in the last part of October, and if all goes well, I will be over there. If you can make it to Toronto, I'll be earlier in Toronto than in New York this time around. You can discuss with Dr. Aarti. Toronto is very close to New York. If it's possible for you, it will be earlier in Toronto and we can meet over there also. Uh, going ahead and going ahead in case of Mr. Joshi. Mr. Joshi, you are a new member for us. Thanks a lot for that. And Namaskar, I'm taking ABA session from 2 years and 9 months. He's improved a lot through brain OR and cooker bit oil, but little bit concern is to increase the sitting tolerance in school. Mr. Joshi, for that to happen, for once if you can connect the school teacher with my psychologist, because what happens is there's a special way for a special child to be dealt with in the school to begin with. At times, it's not the child who is at the wrong end, it is the teacher who is expecting it wrongly. So in the beginning part of his schooling, he will require a bit of support from the teacher, or I would appreciate if you can share some videos of his from the school where we can see if something is going wrong and we can guide you on that. We don't need a medicine change for that, but yes, we need a better ABA for that, and connect with the Gurpriya also for that. Ask the team will be connecting you with Gurpriya for that, and Gurpriya will take a note of that. So thanks for the treatment which you are taking, Mr. Joshi, and it's good to know that yes, uh, your child has really improved a lot with the help of Ayurveda, and that is what always happens. That is what I always tell all of you who are joining us for the first time. I know as a parent it is really tough for you to believe on a treatment system when everyone in the world says that no, it cannot be done. But the most important thing is it's not a trial that we are doing on your child. I am PhD myself, and I was awarded this PhD only because my research was accepted internationally. And that research, my major topic was autism. And I would also like to tell you that currently I am doing DLIT. DLIT is the highest qualification on this globe. And again, this DLIT is in autism. So why I am telling you this thing is that anything which I am giving you to your children, any therapy, any protocols, anything which you are following is tested, is proven. It's not a trial that I am doing on your children, because I very well understand that when we talk about children, a parent can really tolerate something coming on him or her, but tolerating something, any pain, any trouble coming on the child really becomes unbearable for the parent. Being a parent myself, I can understand that. And believe me when I say that, and when parents like you come to me in any part of the globe, I am currently in UK, but wherever I go and whenever the parents they come to me, I always try to make their visit to me a fruitful visit. It's not about selling of any kind of medications to you. It is not about selling something to you. It's more about guiding you, training you. In many cases, when I guide the parents, when I train the parents, when they bring videos to me, they themselves realize that they have been doing certain things wrongly all these years. And that is what added to the woes of their children. And for those of you where the children are really young, 3 years, 3.5, 4, 4.5, 5, 5.6, 7, ask from someone whose child is now 14 years in age and the child is hyperactive. He is really very grown up child now, At 14, 15 years, autistic child really grows up and really becomes strong. Ask from that kind of parent what kind of a life they are having. So it's easy for someone to tell you that you can leave your child to our therapy center. We will take care of your child. You can leave your child to a special school. But do remember all those years of our child which we are killing like this by sending our children to a therapy center, placing our child at a therapy center, someone doing those therapies for our child. We are simply wasting the child's time. It's you who have to do the things. Either you or we can do it for you, but again with your involvement. It cannot be without your involvement. So going to the next question. Before I go to the next question, Mrs. Rosemary, you are there with us and you are asking about my next visit to UK. Yeah, it will take a bit a longer time. I generally come to UK every 6 months, and this visit of mine was a bonus visit, an extra visit, because I am on a delegation that I came to UK this time around. My next visit in UK will be somewhere in the ending part of the April, because as you can see from the questions of many of my patients waiting for me in UK, in US, in Canada, than there are in Australia and in UAE. So my next visits are going to be to those countries. For UK, the next visit shall be in April. So that's why I made it a strong point that although I am not on a visit where it was going to be meant for the parents and patients, I changed many of my curriculums. I stretched my timings to ensure that each and every one of the parents can meet me in this visit of mine. So going ahead with the next question. Amira Sharma ji, you have mentioned that I came across your work late. My daughter is already 10 years old and still not verbal. One of my friends child improved with you. Please tell me if there is a chance to meet you in UK. Amira ji, don't worry. As far as chances of meeting me in UK is concerned, although we have closed all the bookings for UK, but as I just mentioned, my patients and the parents are always my priority. You can get back to the team on the number which is there. They will make sure. I may miss out on an important meeting over here, but it's never a case where I miss out on parents. Yes, definitely, since it's very late. So you will have to rush on with certain videos which my team will ask you to share with us so that all the details can be compiled before you are sitting next to me so that nothing is missed out in that case. So going ahead, and now what I would like to tell you over here is, see, for many of you, there are matters in regards of faith, and that is understandable. It's not easy for you as a parent to be picking up any odd treatment for your child and giving it to your child. But when I guide parents and when my team guides parents to connect on one meetings, to connect on one sessions, it's only and only because till the time we are not interacting with each other, till the time we are not meeting each other, how can faith develop? Once you see our style of working, once you see our style of evaluating each and every case with seriousness, you automatically will develop faith. Because we are very choosy on which case to pick and which not to pick. There are so many cases where nothing can now be done. We straightforwardly refuse those cases. And for all those where we know that yes, a child can come out of autism, our team proactively keeps on following up. They are very active in that because we believe that with so many cases around the globe rising in autism, with so many kids who deserve to have a normal life like a normal adult, merely due to wrong kind of treatment being given, we are making them dependent. Merely because of the belief that a child cannot come out of autism, we are spoiling their lives. And that is very wrong. So, it's not that you are to start a treatment with us or with anyone else, but it's about connecting. It's about discussing, because till the time we discuss, till the time we connect, how can we develop faith? Faith cannot be developed by speaking to a coordinator. Even if you develop a faith like that faith is not going to do anything for your child. The most important is sparing out your time, trying to connect, trying to be on one session, discussing everything, and then if our team really feels that it can be done and you want that yes, it has to be done, you also develop faith on us, then going ahead. And it's only for the first 6 months that you need to believe on what we are saying. You need to believe on our words. After those 6 months, when you see the first changes, many parents see those in hyperactivity. Some parents see those changes in the form of the child now starting to use single or two words like mama, papa, biscuit, apple for the things the child wants and other such stuff. When the parents start visualizing these changes coming in their child, then they do not have to believe on their words. They then can believe on our work. So it's only a belief of first 6 months which is tough, and that is why I always connect live. I go from one country to other, and it's easy for me to be sitting at one place and waiting for you guys, but I know it's not the way in which faith is going to develop for you. So going ahead with the next question. The next question is from Bhakti Bhav ID, and you are a new member. Thanks for your membership. Hi sir, one of my friends had taken treatment from their son. After consulting you and their child has shown great progress. On their recommendations, I would like to consult you, my child. My child is 5.5 years. First of all, I would like to thank your friend who recommended us to you, and believe me, a day will come when you will recommend us to someone. As your name says, Bhakti Bhav. For those of you who understand Hindi, I would like to tell you that we treat each and every patient of ours, each and every child coming to us with that Bhakti Bhav. It's only that reason why the God, that Almighty, blesses us and blesses us in such a way that we can change life of those coming to us. So don't worry, your child is 5.6 years in age. Yes, he definitely has passed and crossed the reflex language development age. So, a bit of longer time, but yes, he is still at a age which is a trainable age and everything can be done in his case. Don't worry, connect with the team. I will come to India for a very short span because immediately after that, I have to move to the Canada meet. So if you are from India, you can connect team for India. And if you are from UK, you can connect the team for UK. So going ahead, Sebastian. Mr. Sebastian, you have written that my son 5 years old and non-verbal. I feel I found you a bit late, but I have seen hope through my friend's child progress. Please tell me, how can I consult you in UK? Sebastian, you need to be sharing your question and your queries on the helpline number through a WhatsApp or through a call which is there on your screen. Don't worry, your child is 5 years in age. I would like to tell you it's not too late. It's a bit late, but not too late. Below 4.5 years, it is super quick. From 4.5 years to 12 years, 13 years, it is possible. After 14 years, partial improvement is possible. So don't lose hope. You can go ahead. And Mr. J, thanks for joining us and for taking our membership. I really appreciate that. And you have mentioned that what are the most effective early interventions to help child with autism manage depression and how many parents support these at home. So when we talk about that, when we talk about the things which can be done at home, ABA, a thorough ABA where the parents are trained with the usage of certain herbs that can really change the life of your children. So there are other questions which I may miss out on, and in case of Jason, now I have the details. Jennifer, the details are Breno A, Breno R, WhatsApp DS, and Mukta Pishti. And the ABA sessions are the one which are the most troubling one. They are very regular. Please be regular on the ABA sessions, and then you will not face any problem in case of Jennifer. And yes, I can't see a pumpkin oil being added over their team. If you can add that pumpkin oil, that will really help out. And then I have Portia with me. My son 2.5 years, true, he hasn't been diagnosed yet, but I see some behavior as symptoms of autism. He says few words like water egg, say bless you when he sneezes. Oh, you are visiting tomorrow. That is really good. I'll be waiting for you. And don't worry, you have approached us at a very great age, at 2 years of 2.5 years of age. Even if he has some problems, they will be rectified very quickly. So going ahead, Jishan Jiaji, every day a new issue rises in behavior, and I am very worried about how long it will take to get better. And Saurav is the coordinator, and you are from US, and you are taking Brain OR. Now the problem again, 4 sessions are the only sessions which are done. Wherever you will see that anyone will be having a problem, it will only be where the ABA sessions are being missed. Please do not miss out on the ABA sessions. Always remember, it is the behavior modification which you are expecting from us. We need to be doing ABA for your child. If we don't do that, how will we modify the behavior? So that is very important for us that you are consistent on those ABA sessions. Please do not miss out on the ABA sessions. So going further ahead, Heaven is the name, and hello sir, my son is very hyperactive, and Mr. Heaven, your coordinator is UK, and he has shared certain details. That name is Pushpinder Kaur, and you started with treatment in 2024. Brainware concentrated, morning, afternoon, evening. Cephalago. Cephalago immediately needs to be changed, and it should be Brainware DS. 9 ABA sessions have been completed with Devanshi and Amardeep. And I do not know whether we have met in the last 6 months or not, but Pushpinderji, in that case, it becomes very important that we meet and we discuss certain things. And in any case, 9 ABA sessions are too less. We require more ABA sessions, and I will also be allocating a few sessions of a senior Gurpriya for you. My team will be connecting you for that. But before that happens, what is very important is that if you really started in January, we are now sitting in September. I don't know whether we met the last time around or not, but do not carry on with the same kind of a stuff without meeting me. It becomes very important for me to analyze, to evaluate. So there are further questions from your end, Rajeshji. I acknowledge your question, but since the time is not allowing me, and there is one or two general things which I want to share with you as a doctor, as a psychologist, and the things is that when we talk about a disease like autism, it is not a disease with which God sent our child with. In many cases, autism developed in the child because of a high screen time, because of a lack of socialization, because of a lack of time which the child deserved from the end of the parents. In many cases, in other cases, I see there are some family atmosphere where the parents are not having a very healthy relationship in between them, or even if they are having healthy relationship, the parents keep on blaming each other for the child's condition. In all those cases, it is not a God made disease, it is a man made disease. And since the God sent a perfectly all right child at our home, it becomes our utmost duty to ensure that we once again make that child perfectly all right. Sparing out your time for your child becomes your utmost duty. Do not leave your children at therapy centers. Do not let your children waste their valuable time in their early childhood where they can make it out of autism just because you are not having the deserving time. So take the first step. Panditji, I have seen the ID is Panditji, and there is XEID. The ID, hi, I have an autistic son. He is 5 years old, looking for anything that can help him development. Currently, symptoms rocking back and forth, non-verbal, minimum eye contact, sensory using mouthing. Now, there are the very common things when we talk about autism, mouthing and the sensory issues. They gradually start creeping in because being autistic, the child doesn't get a proper method in which he can share his emotions with us. Don't worry. Whenever we start correcting it for your child, those things will also start coming down. But the first step is increasing the percentage usage of a subconscious mind. Now, that is something which is very important. So, don't worry, all that you have got to do in that case is share some videos of your child, and once you share those videos, I will be updating you in that regards also. So, for the day, I would like to tell you that I'll be taking a break from you, or clotrimazole and candid cream. Panditji, the ID you have shared, you can share that question in personal with us on the number, and my team will be guiding you. Otherwise, there is no harm in using clotrimazole, candid B cream. Always prefer using candid B formula. Use clotrimazole, which is of a good company. Do not test any generic medication on your child. So, thanks a lot for joining us today. For all of you where your questions remain unanswered, you can WhatsApp us, you can mail us. The numbers are on your screen. Take the first right step and you will see the changes coming your way. And to enhance your belief in Ayurveda, immediately after this live of mine, don't go away. There are some videos, there are some case studies awaiting all of you where you feel that yes, it cannot be done. Once you listen it from the parents who say it can be done, it will really motivate you as parents. So, namaskar, don't go away. There are the videos coming your way. Bye-bye.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Parth, age 3 years, disease autism. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, less understanding. The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
करो
आ जाएगा वो.
कलर करो. वेरी गुड पार्ट. कलर करो. नो, इस हैंड से कर. वेरी गुड. इसके अंदर रख दो. वेरी गुड. पापा का हैंड, दीदी का हैंड पकड़ो. हैंड. चलो. वेरी गुड. खाओ. वेरी गुड. हेलो पेरेंट्स. पार्थ हेलो करो. हेलो करो. ये पार्थ है, मेरा बेटा. 4 साल का होने वाला है. लास्ट ईयर जुलाई में हम डॉक्टर नवदीप शर्मा सर के यहाँ पहुँचे थे. हमें एक सर ने मेरे बताया था सर के बारे में. हमने सोचा भी नहीं था कि आज 9 महीने में पार्थ मम्मा पापा हमसे बोलेगा इतनी जल्दी. हम तो मतलब बड़ा एक माँ पेरेंट्स के लिए एक रहता है कि कब हम मम्मा पापा सुनेंगे पार्थ के मुंह से. आज पार्थ मम्मा पापा और विद सेंस सब कुछ बोलता है. भगवान की कृपा से और सर की मेडिसिन और सर के गाइडेंस से आज 9 महीने में पार्थ एक नियर टू नॉर्मल लाइफ जी रहा है. और स्कूल में भी पार्थ प्ले ग्रुप में था. अभी जस्ट 15 दिन पहले ही स्कूल में मैम ने बोला कि पार्थ को हम नर्सरी में भेजेंगे. और जो सर ने जो लाइफ में हमारी खुशियाँ दी हैं, बहुत एक पेरेंट्स के लिए इससे ज़्यादा और क्या हो सकता है कि उसका बच्चा इतनी जल्दी और इतना अच्छा इम्प्रूवमेंट हो जाए. एक पेरेंट्स के लिए बहुत बड़ी बात है. थैंक यू सर, थैंक यू वेरी मच हमारी लाइफ में इतनी बड़ी खुशियाँ देने के लिए. थैंक यू एंडी निरोगम.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Vivan, age 4.5 years old, disease autism. Chief complaints: speech delay, less understanding ability, inexpressive, sensory issues, lack of focus. The parents of the child consulted Dr. Navdeep Sharma on 27th November 2022 at 11:00 a.m. and felt the scope of treatment to work for the child. The chief complaints were speech delay, unable to write, and sensory issues. The child could not write by himself. He was also not very socially active. Throughout the treatment, significant improvement was seen in the child. He started writing on his own, gave answers, and also became active. He started interacting more and gave answers instantly. His focus also saw an improvement. He also participated voluntarily in activities and also excelled academically. Instant responses were also seen within a few months of treatment. With improved attention span, he became quick in recognizing and mind games as well. He was able to interact more with peers, participate in class, and also understand things in a better way.
हाय, मेरा नाम प्रिया है एंड मेरा बेटा है 5 साल का होने वाला है एंड मुझे नवदीप सर से मेडिसिन लेते हुए मोर देन 1 ईयर हो गया है एंड आई हैव चेंज लाइक आई हैव सीन इमेंस चेंज इन माय सन। लाइक जब हम यहाँ पे आए थे तो ही वॉज लाइक वो एक एक वर्ड ही बोलता था एंड जब से हमने मेडिसिन शुरू की है एंड मेडिसिन के साथ साथ शिरोधारा भी इसकी मोर देन 1 ईयर से चल रही है एंड विद कंटिन्यूटी ऑफ दिस मेडिसिन एंड ऑल उसमें ड्रास्टिक चेंज है। जैसे अभी वो सब कुछ अपनी चीज़ें 99% अपनी चीज़ें वो बता पाता है ईजिली एंड दैट टू दे स्टार्टेड मेकिंग फुल सेंटेंसेज ऑल्सो। क्लास में भी अकेडमिकली ही इज़ गोइंग सुपरबली ऑसम। ही हैज़ स्कोर्ड 88% इन हिज लास्ट टर्म एंड जहाँ पे जब वो नर्सरी में था ही जस्ट स्कोर्ड 55%, नॉट इवन 50%। एंड अभी जस्ट टर्म ए में ही इज़ इन जूनियर केजी, अभी टर्म ए में उसके 88% नंबर आए हैं। नाउ ही हैज़ स्टार्टेड राइटिंग ऑल्सो। पहले वो मतलब पकड़ के लिखता था, पेंसिल पकड़ के, उसका ग्रिप भी प्रॉपर नहीं था बट अब वो लिखने भी लग गया है। प्लस मुझे जो मेडिसिन से जो मुझे मेन फ़र्क दिखा है दैट इज़ सेंस, जो मुझे चाहिए था कि सेंस में थोड़ी सी डेवलपमेंट। पहले उसको फ़र्क ही नहीं पड़ता था कि कोई घर में आ रहा है जा रहा है, वो जस्ट कमांड वाइज ही चल रहा था। लाइक ही स्टार्टेड फॉलोइंग माई कमांड्स, लेकिन अपने दिमाग से वो कुछ नहीं कर रहा था। बट जब से मेडिसिन लेना शुरू किया आफ्टर 3 मंथ्स मुझे ज़्यादा चेंजेस दिखे हैं। 3 मंथ्स में धीरे धीरे चेंज आए। अब विद इन अ ईयर तो ड्रास्टिक चेंज है। जैसे उसको देख के आप बोल ही नहीं सकते हो कि दैट ही हैड माइल्ड ऑटिज्म, तो उसको माइल्ड ऑटिज्म ही था बट अब वो माइल्ड ऑटिज्म के स्पेक्ट्रम से भी निकल गया। अब जस्ट उसके थोड़े थोड़े सिम्टम्स रह गए हैं एंड वी आर स्टिल इन टच विद नवदीप सर। वी आर स्टिल टेकिंग द मेडिसिन। उनकी जो भी गाइडलाइंस है, बीट डाइट, बीट उनका यंत्र, वी आर डूइंग दैट रिलीजियसली एंड आई मीन इट। विद दैट हम उनको हीलिंग म्यूजिक भी सिखाते हैं जिससे बच्चा इंटरनली भी हील होता है। मेडिसिन हम दे रहे हैं। सो आई एम क्वाइट हैप्पी विद दी मेडिसिन एंड फैसिलिटीज। द डॉक्टर्स आर एवरी टाइम अवेलेबल और मुझे हफ्ते में 1 साल से ज़्यादा हो गया, मुझे हफ्ते में 1 कॉल ज़रूर आता है यहाँ से दैट यू नो वेदर द थिंग्स आर गोइंग राइट। विवान के बारे में दे आस्क कि वो कैसा चल रहा है। तो लाइक दे आर इन टच, द होल टीम इज इन टच विद मी मोर देन 1 ईयर। मेडिसिन यहाँ पे टाइम से आ रही है, हमें घर पे डिलीवरी मिल जाती है। जब हमें आना होता है नवदीप सर के, हमें कॉल्स आ जाते हैं दैट यू नो वो अवेलेबल है इफ़ यू वांट टू मीट। तो द एज अ क्रक्स आई एम सेटिस्फाइड विद द मेडिसिन ऑल्सो एंड विद द स्टाफ ऑल्सो। थैंक यू।
Autism is a temporary phase in the life of a child if treated timely.
Patient name Bhanu Pratap, age 6.7 years old, disease autism. Chief complaints: hyperactivity, speech delay, communication, short sitting, problem with understanding. The parents of the child consulted Dr. Navdeep Sharma on 2nd November 2022 at 11 o'clock am and felt the scope of treatment to work for the child. The chief complaints of the parents of the child were hyperactivity, speech delay and short periods of sitting. The child also did not communicate much. Within a year of treatment from ND Care, a significant improvement was witnessed in the child. His condition showed positive results with reduced hyperactivity, improved speech, better understanding and longer sitting. He even communicated and expressed his feelings in detail. Participation amongst peers has also increased. The child also participated actively in his school activities and showcased confidence.
बच्चे का ट्रीटमेंट हमारा चल रहा है तो हमारे बच्चे की बहुत अच्छी इम्प्रूवमेंट है। पहले तो हमारा बच्चा बात भी नहीं करता था, कोई समझता नहीं था। अब इसमें स्पीच भी आई है, अंडरस्टैंडिंग आई है जी। अभी मतलब बैठ जाता है, पहले 10 मिनट में बैठता था। काफ़ी इम्प्रूवमेंट हुई है बच्चे में, पहले कुछ भी नहीं था मतलब। तो सारी हमारे लिए भगवान है। मतलब पहले हमें पता भी नहीं था, सरकार को पता होता तो हम पहले से ट्रीटमेंट स्टार्ट कर देते। तो हम खुश हैं अपने बच्चे के लिए।
Autism is a temporary phase in the life of a child if treated timely.
Patient name Ritika, age 20 years old, disease autism. Chief complaints: hyperactivity, behavioral issues, shouting and screaming, irritation. The parents of the child consulted Dr. Navdeep Sharma on 23rd January 2023 at 3 o'clock pm and felt the scope of treatment to work for the child. Before the treatment, the chief complaints were regarding hyperactivity, shouting and behavioral issues. She screamed abruptly and showed irritated behavior frequently. With the ongoing treatment, significant improvement was there in her condition. Hyperactivity was reduced a lot. She also became more calm and also stopped shouting. Along with that, irritated behavior also showed improvement. She also got involved in co-curricular activities like sketching and painting, which improved her performance. She also showed a lot of growth in terms of expressing herself. She started singing and other activities.
हम रणजीत सेन हैं। माय डॉटर का नेम है रितिका सेन। शी इज़ एन ऑटिस्टिक पेशेंट। 1 साल पहले गूगल में डॉक्टर नवदीप शर्मा को देखा, उनका साइट देखा, तो उसके बाद हमने कांटेक्ट किया है और 2023 जनवरी से हम मेडिसिन ले रहा है अंडर सुपरविजन डॉक्टर नवदीप शर्मा। 9 महीने में हमको बहुत ही असर मिला मेडिसिन से। पहले शुरू में मेरा बच्चा चीखते थे, हर टाइम अचानक चीखते थे, हर टाइम चिड़चिड़ापन रहते थे, हाइपर था, बहुत ही हाइपर था। मेडिसिन लेने के बाद उसका ये चिड़चिड़ापन, एग्रेशन बहुत ही कम गया है। मेडिसिन के साथ साथ पंचकर्मा भी दिया है और साथ में साइकोथेरेपी भी चल रहे थे। तो ये साइकोथेरेपी, पंचकर्मा और मेडिसिन लाके कुल मिला के मेरा बच्चा अभी बहुत ही बेटर है, पहले से बहुत ही बेटर है। आयुर्वेद में हमको लगता है डॉक्टर नवदीप शर्मा स्पेशली फॉर ऑटिज्म के लिए बहुत ही अच्छा डॉक्टर है। थैंक यू।
Autism is a temporary phase in the life of a child if treated timely.
Patient name Herbal Singh Tomar, age 4.5 years old, disease autism. Chief complaints: speech delay, hyperactivity, poor eye contact, less social interaction, low attention span. The parents of the child consulted Dr. Navdeep Sharma on 10th August 2023 at 10 o'clock am and felt the scope of treatment to work for the child. The child was diagnosed with autism spectrum disorder, which caused the issues of hyperactivity, social interaction and speech delay for the child. With the onset of treatment, the results started showing up. There was an improvement in hyperactivity and increased social interaction.
मेरे बेटे का नाम हीरवराज सिंह तोमर है। हम लोग भोपाल से आए हैं। मेरा बेटा जब 3.5 साल का था तब वो उसको डायग्नोस हुआ था ऑटिज्म। फिर मैं रेगुलर रिसर्च करती रहती थी बोल में। फिर मैंने एक बार यहाँ रिस्ट पुस्ट का और एंटी केयर के बारे में सर्च किया, तो यहाँ पे पूरे कॉन्फिडेंटली सर ने बोला है कि ये सिर्फ एक टेम्पररी स्टेट होती है लाइफ में बच्चों की। तो वहाँ से मुझे लगा एक बार मुझे देखना चाहिए। फिर मैंने ऑनलाइन सेशंस लिए, थोड़ी हाइपरएक्टिविटी कम हुई, थोड़ी सी स्पीच भी डेवलप हुई। फिर उसके बाद हम लोगों ने फिजिकली ये जो चंडीगढ़ सेशन यहाँ पे जो इन लोगों का सेंटर है यहाँ हम लोग आए, वहाँ हम लोगों ने पूरा जो इनका पंचकर्म और सारे जो सेशंस होते हैं योगा EVA क्लासेस सारी। तो अभी हमारा आज 4th डे है। 4th डे में मुझे काफ़ी अपना बच्चा रिलैक्स लग रहा है। उसमें काफ़ी अच्छे चेंजेस मुझे देखने को मिल रहे हैं। स्पीच भी जनरेट होना और अच्छे से स्टार्ट हो रही है, सेंटेंस भी उससे बुलवा रहे हैं तो बोल रहे हैं। और यहाँ के जो सारे स्टाफ मेम्बर्स हैं वो काफ़ी सपोर्टिव हैं, बहुत अच्छे से सारी सेशंस और क्लासेस जो भी होती हैं सारी चीज़ें बहुत हेल्प कराते हैं। यहाँ का स्टे भी बहुत अच्छा है, तो मुझे यहाँ ओवरऑल सारी चीज़ें अच्छी लगी। मेरे बच्चे को भी काफ़ी